In this episode, we're going to talk about technology causes of job-related distress in healthcare. Welcome back to another episode on burnout among medical professionals. This is Rajeev Kurapati. We're talking about job-related distress in healthcare. In this episode, how is technology, which is supposed to help the healthcare professional and the patient, is actually causing job-related distress in healthcare? When electronic medical records were rolled out to many hospitals across the country, especially in the United States, we have seen a significant jump in job-related distress and a decreased job satisfaction among many medical professionals in United States at least. And when they did research across the world, they also found that the same is the story in many countries where electronic medical records were introduced. So now let us see why something that is supposed to help is actually causing distress. Now, this problem or this issue has to be looked at two different levels. One is at the technology level, and the second one is at the commerce level. At the commerce where you're talking about the payment systems involved in it. And then let's look at the technology part of it first. When you look at the current state of technology, where are we at in the timeline of technology and in the timeline of the evolution of technology? We can say that we are at a very early phase in technological adoption or adoption of technology in healthcare. In specifically electronic medical records or digitization of the health records. So one can say that we are actually in a pubertal stage in this evolution of digitization of the records. Now I'm going to read out a couple of lines from the book, The Physician, How Science Transformed the Art of Medicine, related to this topic. If you're interested, you can follow me on page 244. I'm in page 244. The book is Physician, How Science Transformed the Art of Medicine. In 1930, an English economist, John Maynard Keynes, predicted that by 2028, our technology would permit us to work 15-hour weeks, 15-hour weeks, and dedicate the rest of our lives to leisure. Now, we know that in less than a decade, that's not going to happen, at least looking at the current state of affairs. According to this English economist, in less than a decade, we'll be working about a third of what we're working now and spend the rest of the time in leisure and probably make about the same or more as what we're making now. Of course, he's not talking about medical professionals, but he's talking about economy in general because of technology. But if you look at the current state of affairs, the healthcare professionals are not working less, but actually working more number of hours because of the digitization. I'll tell you why this is the case. If you look at page 245, the current state of affairs in medical technology. Currently, most patients' information is manually entered into an electronic health record, typically by a doctor, nurse, or other healthcare staff. So imagine a situation where the patient comes to the clinic or the hospital. A healthcare professional enters the data, and then another healthcare professional comes in and enters the data. Another specialist comes in and enters data. So the number one cause of distress is this relentless data entry system that is happening in the current state, where a human actually collects the data, enters it, and another human enters the data. The next day, and another human enters the data. This continuous data entry business, or the job of a healthcare professional, has become a data entry clerk. This is the number one cause of job-related distress, where more time is spent with the computer than actually face-to-face with the patient. So now you have to see where we're at in the evolution of technology. See, in future, the goal of technology is to relieve the professional of all these duties, actually, the data entry, the shadow work, the scut work that is involved in non skilled work that is involved in these kinds of jobs. So when machine to machine communication happens, now see, a human being enters the data into the machine. But in future, what happens is our smart devices that we carry with us are going to collect the data from within our bodies, within our innards. For instance, it's going to collect continuous blood sugar, continuous blood pressure monitoring is going to happen, and other parameters such as changes in the body mass index, changes in the cholesterol built up in our blood vessels, and all this data will be the collected data by the biosensors that we carry with us. When the technology matures in future, this data will be sent from this machine to another machine at either the hospital or the clinic. When such a machine to machine communication happens, this data entry clerical business is going to come down dramatically. And the next phase of this evolution in medicine would be, apart from the machine to machine data collection, the computerized diagnosis aids are going to gather all this information and generate a diagnosis, not by the physician or the healthcare professional, but the machine itself, the computer itself is going to generate the diagnosis. And the phase next to that, the further evolution of medicine, would be to generate a treatment plan. So without the involvement of the medical professional, this machine-to-machine communication, artificial intelligence is going to generate not only the information, but the diagnosis and also the treatment plan. And when this happens, most of this clerical job is going to be eliminated. Now, at that phase, we're going to face a whole different set of problems, such as what is the role of the medical professional when all this is being carried by, when all the decision making is done by the machines, when the cognitive capabilities of the individual, of the professional, is surpassed by the machine computing capacity. So what is the role of the physician? So these are the things that these are the issues that would become important at the time. And the second point would be, who pays for it? How do you handle the commerce side of it? How do you handle the business side of it? When the machine or the computer is going to generate most of the decision making is done by the machines and artificial intelligence, how does the hospital run? How does the clinics run? Who pays for the overhead? All these things a new set of problems would arise. But for now, the current phase in the timeline of the evolution of medicine, we are at a very early phase in technology where most of the professionals have become data entry clerks, spending more time with the computers and then with the patients. The cry is that the humanistic dimension is being lost because most of the professionals are spending time, a third or more of their time with the computers and not actually with the patient. And of course, adding to that is all these requirements by the policies and procedures and guidelines and standards and licensing requirements and billing requirements and coding requirements. All this has added a whole lot of stress on the already worked out professional. The only solution to this is a proper communication between the people who are actually creating these electronic systems, electronic medical or healthcare records, and the people who are using it. And the administrators are the one who would coordinate, who would help in this communication. Unless a proper communication channel is established, a system is established where problems are identified and immediately tackled by the people who are making and by the people who are using it, unless a proper communication happens, we are going to shout and yell and bitch about this problem. We're going to point fingers, saying that you're responsible for it and I'm not responsible for all the mess caused. So the problem that we face right now is that the administration or the policymakers have no clue what's going on at ground level, at the front lines. The healthcare professional, how they have created a system and then thrusted on the professionals, and the professionals are getting stressed out, and the administrators and the policymakers have no clue. And what they think right now is by introducing techniques such as wellness programs and meditation techniques, mindfulness techniques, and yoga programs, this issue of burnout is going to get resolved. No, it'll not. Because the problem is not with the individual, the problem is with the system that was created and the phase we are in this evolution of the technology. So in future, the goal is to circumvent, bypass all this data entry that is happening now. But again, unless we are prepared for the future, we'll face a whole different set of problems. The ones we talked about, like what is the role of the medical professional, who pays for all these things. So unless we address the current problem by establishing a proper and a timely communication channel, and with an eye into the future, we will continue to face the problem now, and we'll face bigger problems into the future. So this is about the digitization causes of burnout, a very brief overview of why digitization is causing burnout and what we can do about it. And until we meet again, remember, be good and stay healthy.